Good afternoon, everyone. Before I begin, I'd like to acknowledge that we're gathered on the land of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. My name's Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer, and we're here to provide an update on the healthcare professionals' vaccination reporting. In October 2021, Dr. Henry created a new order that requires all professional health colleges to provide personal information about their registrants to the Ministry of Health. This order impacts 18 colleges. We've made the commitment to share the aggregate vaccination rates by professions, and this is why we're here today. The goal of sharing this data is to make sure members of the public have the general vaccination information they need to help them make informed decisions as they seek treatment or services from a regulated health professional. Data that we're reporting on today are for 17 of the 18 colleges. About 94% overall have been vaccinated or are medically exempt. I just want to note on the 17 or 18 side, we're not reporting data from the College of Nurses and Midwives today, but you do have very significant information. We know that the vast majority, and I mean the vast majority of nurses, work in the public healthcare system, and the vast majority of those nurses have been vaccinated to the tune of 99%. So when those numbers are introduced finally into these numbers, we'll see them go up, not down. That nurses are extremely well vaccinated in BC. For those of you keeping track of these things, the highest level of vaccination is the College of Dietitians, followed by the College of Physicians and Surgeons in BC at 98%. It's expected, as I say, the data for all things, including nurses, will be available in the coming weeks. And just remind everyone that nurses represent about 46% of all those in health professional colleges. So they're about, the rest of them are about 67,000. The nurses are about 63,000. That's why it's taking just a little bit longer. I want to say two things just finally, and then I'm going to hand it over to Dr. Henry. The first is that about just under 80,000, 78,362 people in BC have received their fourth dose of COVID-19 vaccine, that the priority in the month of April was long-term care and those who are clinically vulnerable, who had received, in effect, their first or their third vaccinations soonest. Over this month of May, we're going to see a very high number of those over 70 reach 182 days and then be eligible for their fourth dose vaccination. We're going to have a week, next week in fact, when 75,000 people over 70 reach that level, and they'll all be invited to be vaccinated. And as you know, there are hundreds of locations across BC, in the hundreds, particularly in community pharmacy, some from health authorities in community pharmacy, and we encourage everyone. Haven't got your first dose, get your first dose. And happily, I'm happy to say about 1,000 people have received their first dose of Novavax since it's become available, and more are coming every day. If you haven't got your second dose, get your second dose. If you haven't got your third dose, get your third dose. That's more than 1 million people invited who haven't got their third dose yet. And of course, for those over 70, those who are clinically vulnerable, for those who are on long-term care or supporting people in long-term care, that's vital as well. So with that, it's my honor to introduce Dr. Bonnie Henry to share a few words.
Thank you very much. It's been a while. And thank you. As you know, we've been on a long journey around vaccination, and we have safe and effective vaccines that have really changed the game for us. As you know, in October, we issued an order around hospital and community healthcare and other services COVID-19 vaccination status, and that meant that people can be reassured that in our public healthcare system across the board, from hospitals to community to long-term care settings and public health settings, everybody who they receive services from is vaccinated and protected. And these orders have helped protect our healthcare system by ensuring that we have that high level of coverage in these essential healthcare settings. And I just want to express my gratitude to my colleagues across the board for stepping up. We also recognize the important role of healthcare providers not covered under that order, and that's why we put in place this information, primarily, firstly, an information status and prevention measures order that applies to regulated health professionals. So BC, as every other province in Canada, has a Regulated Health Professionals Act that creates what we call a college. And I'm expressing this because I've had some people explain to me that they're confused about what this is about. So the colleges, so the College of Physicians and Surgeons, for example, is the body that's responsible for licensing and establishing standards of practice for physicians and surgeons in the province. And the same happens for the other 18 colleges that we have in British Columbia. And they have an important role of, as I said, establishing these standards of practice, ensuring that people who are licensed to practice as a regulated health professional meet the standards for licensing, and their primary role is protection of the public. And this is what a profession is having a self-regulating body with the focus on protecting the public. So I've been working, and my office have been working with each of the colleges to first understand the vaccination status of all of the registrants, so all of us who are registered and licensed to practice, and then to develop the standards so that we can ensure people can make their own informed decisions about whether to receive in-person services from a regulated health professional. So not surprising to me, much like other British Columbia residents, there is a very high degree of COVID-19 vaccination coverage amongst all regulated health professionals in British Columbia. Among practicing regulated health professionals, 93.9% have completed at least two-dose vaccine series or have a medical exemption from my office as of April 25th. So as the Minister indicated, we have not yet got the final numbers from the College of Nurses and Midwives, and this is because there are so many registrants, and it is a process, and I've mentioned this before, that it was a lot more challenging than we initially thought in terms of being able to link people and then determine and have the colleges reach out to each of the registrants for whom they did not yet have information on vaccination status. So the aggregated data that we're putting out today likely underestimates a little bit vaccination coverage, mostly because, as we mentioned, the College of Nurses and Midwives have had some challenges in getting the status. And there also is, we have a column where people are either known to be non-vaccinated or for whom we don't yet have information. And as you are probably aware, there's new registrants, new people coming in to practice in different parts of our health system every year and every month. And so it takes some time for those to be updated. But what we do know, as was mentioned, the College of Dietitians, so people who work in our dietary world across the board, and the College of Physicians and Surgeons are the highest rates at 98%. And the College of Occupational Therapies is close behind at 97%. And we've put out a list so people can see. And this will help you understand that the levels of immunization are very high in most of the registered health professionals. Practicing registrants who are least likely to be reported as fully vaccinated are the College of Naturopathic Physicians, the College of Chiropractors, and the College of Traditional Chinese Medicine Practitioners and Acupuncturists. And there's some variation between each of the regulated health professionals amongst those colleges. But I will say that I am very proud that all of these are very high rates of immunization. And I think we can be reassured that across the board, regulated health professionals understand the value of vaccination in protecting both themselves, the people they work with, and the people we care for. We will continue, my office, to work with each of the colleges to ensure that we have standards in place so that people will be able to make informed decisions as they seek treatment from individual practitioners across BC. So because we have this very high rate of protection from vaccination, it has meant that we have weathered this Omicron storm over the last few months without overwhelming strain on our healthcare system that has been seen in some other jurisdictions. But it has not been easy in any way, and I cannot imagine where we would be if we had not stepped up across this province to thank everyone who did their bit by getting vaccinated. This has allowed us to remove restrictions and get back to more of those important, essential social and other activities that we love, and to come together again. But we know that hospitalization and infection rates from the data that we put out, they've leveled off somewhat. But we are still in this pandemic, and we know there are still strains on the healthcare system. And as we come together more frequently with more people, the virus has more opportunity to spread. And we are seeing that. I don't think there's anybody that I know, certainly not in this room, I don't believe, who hasn't known somebody who has had most likely Omicron in the last few months. We also know that the protection from 2 doses of vaccines or from recent infection does wane over time, and particularly for milder infections, it is still a very strong protection that we are seeing against hospitalization and severe disease, but now is more important than ever to get that booster dose. And I encourage everyone who has not yet received that dose to get it now. It is not too late. If you've had an Omicron infection in January, February, you're now at a point where you need to get that extra boost as well. We continue to see circulation of BA.2, and particularly the strain that is even more infectious, the BA.2.12. We see that in certain areas of the province more than others. And we are also seeing some other variants like the BA.4 and .5, which are seen in other jurisdictions as well. What we know now, in reality, is that 3 doses of a primary series of vaccine is needed to protect against Omicron. And yes, it does increase our protection against infection, even mild infection. And it also boosts that protection against severe disease and protects you from some of the long-term complications of COVID-19 that we are seeing even young people with milder illness can experience. I also would encourage everyone who is 70 or older, First Nation, Métis, and Inuit peoples in British Columbia, 55 years of age and older, and people with immune-compromising conditions, so our CEV groups, to get their second booster or 4th shot. We know that also makes a difference right now. We need to be aware that the SARS-CoV-2 virus is still circulating around the world, and I don't need to say that. This virus is pernicious and it's changeable. So while the level of immunity that we have from recent infection and from the high rates of vaccination we have here, and the fact that we're entering the spring and summer season where we know there's a bit of seasonality to this virus spread, means we will likely have some reprieve in the next few months. But we need to plan for what's coming, and particularly I'm concerned and working with my team to look at what are the possible scenarios that we may face given our situation, our demographics and our immunity levels here when we get into the next respiratory season in the fall. We will need to manage influenza. We're starting to see a bit of it now, but influenza will come back in the fall now that we're traveling more, now that we're connecting more. And we'll have on top of that the usual things that we see like RSV and also COVID. This virus is going to be with us for some time. We do not yet know if all of us will need another dose of vaccine come the fall, or if protection from the 3 doses will carry most of us through, and only some people will need another dose. Those are the things that we are planning for the future. We're watching closely and we're planning for how that will happen now. We have come through this latest challenge because people in BC have continued to take those measures to protect themselves, their families, and their communities. Our weekly surveillance reports gives you the sense of what I call our COVID climate, where we are facing, what are the trends that we're seeing right now over time. And then every day we need to monitor the weather in our own context. That means asking ourselves, am I up to date on my vaccinations? How am I feeling today? If I'm not feeling well, I can use the rapid tests that are available, and I encourage people to pick those up. They can help. But it also is about taking that responsibility to say, if I'm not feeling well, what am I doing? Who am I going to be with? And maybe I need to postpone a visit to an elderly relative until I'm feeling better. Or if there's people in my close family or social circle who I know have COVID, then we need to take a step back from some of the riskier activities. If I'm going to be in an indoor place with a lot of people that I don't know for a longer period of time, then bring a mask and wear a mask. That will protect you, and it helps protect others. We are transitioning through this emergency phase of the pandemic, but we still need to be vigilant, and we still need to be aware of the things that we make a difference both for us personally and for those around us. We're not through it yet, but we are making a difference, and we need to continue to support each other as we have throughout this very long storm, with compassion and with kindness. Thank you. We're happy to take questions.
Thanks very much. To media on the phone line, please press *1 to get in the queue if you're not already there. We are going to go to questions in the room first. If you are comfortable in the room with lowering your mask while you ask a question, it's easier for us to hear that way. We're going to start with Richard Zisman.
Vaccine questions on both ends of the spectrum. In Quebec, they have opened up 4 doses for all adults now. Why is British Columbia not doing that? In terms of the oldest British Columbians, are you concerned about the uptake so far on 4 doses? And on the flip end, is there any update from Ottawa on vaccine for 0 to 5-year-olds and whether we may be getting any news at some point that they are eligible for vaccine?
Yeah, so there is a little bit of news. I'll start with the second one, and it's not 0. We do know that the developing immune system probably doesn't respond to vaccination and has some protection from your mother or your up to about 6 months. So we do know Moderna has put into Health Canada submitted data for 6 months to 5 years of age. So that is the next one that we're likely to see. Health Canada has just started looking at those data, and it often takes several weeks to months. It has not been approved for use anywhere in the world yet, but it's good to know that that's coming. The Pfizer version is, as you know, you may recall, the FDA had asked for submission early on in the fall or in late winter, but it turned out that the formulation that was being used for the 6 month to 5-year-olds, because was not giving a strong immune response with the 2 doses. So they have added a 3rd dose, and they are not yet at the point where they've submitted data for the outcomes of that yet. It may be by late spring, early summer, they may have that. So it is potential that we'll have vaccination for younger kids as probably maybe even as early as late summer. So that's something to look for. In terms of why we've put the cutoff at 70, we looked at a lot of the data of who was getting infected, who was having waning immunity over time, and also the program that we have around clinically extremely vulnerable, which is different. Most other provinces have not identified that group of people. And we look at our hospitalization data. So who is it that is vaccinated with 3 doses that is ending up having more severe illness? And it is people with severe clinically immune compromising conditions. So people with solid organ transplants, for example, hematologic malignancies. And so they need an extra boost, an extra dose. And we've also seen that there really is very good protection from 3 doses for most people up to age, actually really up to age 80, but definitely up to age 70. And we see a little bit of an increase in hospitalizations over age 70, people who've had 3 doses, and it bumps up again over age 80. So those are the people who got immunized first, so their immunity is going down more quickly. And as we get older, our immune system fades away a little bit more quickly. So that's where we're targeting this 4th dose. And we need to find that balance of whether you need it and whether how long the protection will last. And so for our data here in BC, from the program that we've had with the intervals we've used, it really is those groups of people who are most at risk and where they need that short-term protection. So what we're seeing from other countries is that 4th dose, that 2nd booster, does give a boost up in protection against infection and also stimulates a stronger protection for more severe illness and deaths. but it also wanes again over time. So what we want to do for most people who still have really good, strong protection from their third dose, and again, I'll say, if you haven't got that third dose, go get it now. That protection is good enough to get us through Omicron and very, very highly protective still for people staying out of hospital and preventing severe illness.
I think Dr. Henry did a good job on sub-questions 2 through 6 there, Richard. I would just say, just on the first one, I think you asked about how it's going in terms of take-up. I mean, principally, the focus has been on long-term care and on the first group of people who are clinically vulnerable, people who have immune challenges. I think in the latter group, we've actually had quite a high take-up, and we'll report on that soon. In terms of long-term care, we're going through systematically, as we did in October of 2021, the long-term care homes. I would say overall the take-up is slightly lower for fourth doses than for third, but the real question will come in the coming weeks, and we want to really encourage people who are over 70 or who are invited for their fourth dose to get it, and all the other people, because the big vaccination task is still all the people who haven't got their third doses yet. We want to really encourage people to do that, and also to say to others that Novavax is available, and people who were considering that, it's available. You can call 1-833-838-2323 and connect then with the BC Pharmacy Association. They'll be in touch for an appointment for Novavax. So that's where we are now, and we'll know more after these big bolus, sort of big groups of people who are seeing, who are going to be invited in the next 2 or 3 weeks. We'll have a better sense of those over 70, probably on or around June 1st.
Dr. River, can you explain why more than 600,000 doses of vaccine have had to be thrown out, and why not then fast track? And I know it's sort of separate, but could you prioritize groups like pregnant women for fourth doses to try to get more people vaccinated? And then also for Minister Dix, I want to get a sense, separate on the regulated colleges, what sort of tools will be at people's disposal to understand who's vaccinated, who isn't, if they go to an office?
In terms of wastage, there's a whole bunch of factors that go into that, and actually our percent of vaccines that have been wasted are very low, which is great. As you know, very early on when supply was an issue, we were very focused on that. A small percentage of the 600,000 or so doses that have been expired, they came to us with an end date that was relatively short. And some of them have expired. Most of that we tried to give back through COVAX, although we've also been able to make donations. Canada has donated quite a lot financially to COVAX, so we're very aware of those issues. But the reality right now is that we have sufficient vaccine, and when we have more providers, so once it's out in the community, in pharmacies, and the uptake is slow, one-on-one, that means that you may have wastage. They have been trying very hard to book people in at a time where you can use the whole vial, but it is more important for us to make sure that people get their dose and don't get turned down for a dose than to preserve every dose in the vial, as it was so critical very early on. So I think we're very mindful. We're very mindful of the wastage, and we're being very careful about it. The vast majority of it is now because there's not enough people to get the vaccines, and there's several doses per vial that may be lost through pharmacies, for example. In terms of the regulated health professionals, and I'll ask that. Oh, and pregnant women. You see, when I talked last time about age, so we are not seeing breakthrough in pregnant women who have their 3 doses, or pregnant people. So we do, again, encourage people to get that first booster dose, the third dose. That is making a tremendous difference in prevention of transmission of infection. And there was a recent report out of Israel that showed as much as 85% in the short term. So that protects you from getting sick, and it absolutely protects you from getting really sick. So anybody who's pregnant needs to get their third dose. There's no need, though, as far as we can tell, in terms of breakthrough infections, etc., for an additional booster dose at this point. In terms of the regulated health professionals, we are working with each college about how to build that into the professional standards, about how to notify somebody. The overriding interest is patient safety and making it safe for people to ask those questions. So there are several ways that it could be. It's for in-person services that we receive from a healthcare provider, and it may be things like when you call to book an appointment, you're asked if you have a preference to see a vaccinated or unvaccinated, or it makes a difference to you for those clinics where that's an issue. So we are trying to work out those details in a way that protects privacy, but also gives agency to people to make those decisions, because it may be different depending on my risk and depending on what's happening in the community. So if we see rates go up in a community and I'm somebody who's more vulnerable, then I may opt not to see somebody for an in-person treatment or postpone that if there's a time when there's a lot of circulation of virus. On the other hand, if I've just received a booster dose and I'm not particularly vulnerable, it may not be as a decision that I may choose not to postpone a visit, for example.
Next we have Katie DeRosa, Vancouver Sun.
Hi, Dr. Henry. Can you give the percentage figure for the naturopaths, chiropractors, and practitioners of Chinese medicine? Yes.
So the College of Chiropractors, 78.1%. College of Naturopathic Physicians of British Columbia, 69.2%. And the College of Traditional Chinese Medicine Practitioners and Acupuncturists was 79%.
Can you speak to why do you think it's so low, and what can you do to boost that?
Yeah, so this is part of this, I know, in my discussions with the registers of the colleges are, some people have been reluctant or slow to respond to the college's need for this information. So it is probably an underestimate. As well, we know that some regulated health professionals have views about the vaccination. And we have only recently had alternatives to the mRNA vaccines available for some people, and that's an important choice for some practitioners. So this will change over time. And I hope that seeing this and seeing that the vast majority in every regulated health professional will be reassuring to people and will help people have that discussion with each other about the importance to the profession.
I would say, and all of the detailed numbers will be shared with you in a press release. And in addition to that, we'll provide the list of the number of registrants, so you have a sense of the size of these health professional colleges, which I think will be valuable. I say this, though, the group of people that will be, I think, most unhappy with those results are the vast majority of people in those three colleges who are vaccinated. Will be the naturopathic physicians who have first volunteered, became part of our vaccination programs, for example, in Vancouver Coastal Health and in Fraser Health. And all the people who work in that sector, they'll be disappointed with that because if you look at the 18 health professional colleges, and nurses will be well north of 95% when those numbers are released. They are now in our numbers for the healthcare system. All of the health professional colleges except those three are in the 90% range. And I think those are very good results. And I think those numbers will be higher there. And the vast majority of people in those three professions are vaccinated. And I think it's that group of people which may have more concerns with some of their colleagues who have, for whatever reason, chosen not to be vaccinated. And but that's the reality we're facing. The public can see that now. And all of these professions have robust debates within them, I'm sure. And I'm sure this will be a subject of discussion amongst all of those as we seek to raise vaccination rates amongst every group in society.
Thank you. We're going to go to the phone now. And first question is from Justine Hunter.
Thank you. Dr. Henry, do you believe that the public should know whether an individual practitioner is vaccinated or not? It sounds like privacy is kind of gotten in the way of that level of disclosure.
Yeah, so what we are working through is how to make it so that it's not a personal disclosure of personal information in a way that protects the practitioner, but the overriding public interest is patient safety. And that is our overriding interest. So it has to be done in a way that doesn't put a person who has concerns about receiving certain services in person and wants to make that informed decision themselves, doesn't put them at a disadvantage. And I say that in a way, one of the programs that we've talked about a lot is it's okay to ask your healthcare provider if they clean their hands. Well, I know that many people, including when I was supporting my grandmother-in-law when she was in hospital, she would never ask because she was afraid that it would somehow be held against her, or that she was afraid to ask those questions. So we don't want to put people in those positions, particularly people who are feeling very vulnerable. So I am working with the colleges, and we all have the same goal, to make sure that people are comfortable receiving those services and feel safe to do it. So we're working through the details of what that will look like, but it will be a process that will do its best to protect the privacy of individual practitioners, but give people the information they need to make an informed decision.
Justine, do you have a follow-up?
I do, thanks. Dr. Henry, just from reading your work over the years, I think you've been a real advocate for vaccination of medical practitioners, and I'm just trying to get a sense of whether your objective here is to ensure that an individual can find out whether a practitioner that they want to see is vaccinated or not, or whether you believe that the privacy rights of those practitioners is a higher value.
Like everything, nothing is simple in this, and yes, I've done a lot of work on things like bloodborne pathogens, healthcare workers infected with bloodborne viruses, and the risk to the health setting. So, and there is ethical principles around protection of privacy that are very, very important, and there's principles around patient safety that trump everything. So it is finding that balance, and I don't know, there are ways that we can do that. We've done it for surgeons who are infected with HIV, for example, people who have hepatitis. So we have models that we can use, and we're just working through how to do that.
Next question is from Lisa Yuzda.
Hello, Dr. Henry, and this is, I'm going to get a bit personal, but I know that there's a lot of people that want to know, as you said, like we all know someone who's had COVID, and we're wondering, have you made it through so far without it, or have you had it, and what was your experience?
No, I've managed to clean my hands enough, I guess, and wear masks in the right places, but no, I have not yet, but I do know that I've been around people that have, and I think we see the results of vaccination and how protective it is. But we also know that people who have a lot of contacts with many different people. I will say, in the last few weeks, I have done more things. It was slightly terrifying at first, but going out I was able to go to the opera for the here in Victoria a couple of weeks ago, and it was just, I think, for me personally, and I know for many people that I hear about, missing those things that gave us joy in life. And we went through a period of time when it was so hard, and we couldn't get together with people, and we couldn't hear live music in a theater with others. And that is so important we're social creatures, and we need that connectedness. So I think, again, we've always tried to find that balance of the negative consequences of the measures that we have in place, and being able to do the best that we can to protect people through this. And I know we're all on our own path in this, and some people are more or less anxious to get there. But I think we're in a reasonable place right now, and I just encourage people to continue to be kind to each other and to remember those moments of joy that have gotten us through this past 2.5 years.
Lisa, do you have a follow-up?
You said earlier, that we are still in this pandemic, but often, you go out to stores or to the hockey game or things like that, and it really doesn't look like it anymore. I'm wondering, do you think that in general we're doing okay and still responding in an appropriate way, and that we'll be able to bounce into a different place if we need to in the fall, or do you have concerns?
I'm always concerned. But yeah, I think the fact that we have vaccinations has led us to this place. And we only have to look at places like Hong Kong and Shanghai to see what can happen if you don't have that level of protection that these vaccines have given us. They are a magic bullet. They're not perfect. And so that's why we all need to do that day-to-day assessment of where we are. But we've done this before. We used to do this. If I'm not feeling good, don't go to school today or don't go to work today. Stay away from that big gathering if I'm not feeling well. And we need to be even more cautious about that because we know this virus is still out there. And thankfully, and most people now, because we have this level of protection from vaccination, they're not getting severe illness. But some people are still getting long COVID, for example, including children, and we've seen that be a problem. So we need to be extra cautious. We need to take those measures that we know help, and check ourselves every day. How am I feeling today? Maybe I need to stay away or do this remotely, and just be respectful of that as we go through this next period of time. I think we're going to be in a period of relative ease for the next little while. But we all have to pay attention to what might happen in the fall. And if we look at data around the world, I mean, it's shocking to think, but there's close to 1 million people now who have died in the United States, at least recorded, and probably more. And if we look around Canada, we have not had that level of devastation and tragedy. But we've had enough. So we do need to be cautious as we go through this, and we need to be prepared that we're going to see a surge in the fall. And there are things that we'll have to go back to remember about how we can do that. I hope and I expect that we'll never have to put in orders that require people to do those things, like we did when we didn't know what was going on over the last 2.5 years. But we will rely on each other to take those measures when we start to see things going to increase in transmission again.
I would say, Lisa, that we're in a very challenging period for the healthcare system. It should be said, though, that we have similar levels of people off sick, and a lot of this, and the principal difference between now and other times was COVID-19. As we did in January, which people will recall was at the height of the Omicron variant of concern. I think you can draw two conclusions from that, is that it's very challenging when you've got, compared to the normal time, this week we had between 17,000 and 18,000 people who missed at least one day. It doesn't mean they're off sick all day, but at least missed one day as a result of that across the healthcare system, and that's a significant number of people. Now, there are always, because it's a huge healthcare system and a huge number of employees, a lot of people off sick, but this presents challenges for everyone else. And I think as well you're seeing, because of what's happening in society, a return to healthcare as well in a dramatic way just at this time. So I think people have to keep in mind that it's happening. The second thing I'd say, though, is some extraordinary things are happening in spite of that. Consider that, and consider that we had one of our most recent reporting period, most significant number of surgeries that we've ever had in the BC healthcare system. In spite of that, it shows how dedicated, how hard people are working on producing the best possible outcomes. But this is a challenging time because the pandemic is still here. It's still having effects. Those effects are different, but they continue to challenge our healthcare system and healthcare professionals and healthcare workers everywhere.
Next question is from Rob Monroe.
Hi, Dr. Henry. Thank you for this. I just wonder, in the numbers for the colleges, is there any breakdown for by health region? I know the interior health region is about 5% below the rest of the provincial average in terms of regular vaccination. So is there that kind of difference here as well, the colleges?
No, we have not broken it down. The colleges are a provincial level entity, so I'm afraid there's no breakdown by regions at all.
Do you have a follow-up, Rob?
You'd also mentioned about the BA 2.12 is coming up in certain regions of the province, and again, concern the interior sometimes has led the way in some of these things, and is that a problem here?
You know what? There has been an increase in the 2.12, and I'm just trying to remember the latest whole genome sequencing. Our those pictorials we have with the different colors. It is on the BC CDC website, and there has been slight variations in different areas of the province about which strain we're seeing. And yes, we are seeing some of the BA 1.12 in the interior, and I believe the island was the other area where we saw the most, but I can check on that for you.
Next question is from Rob Buffum.
Oh, hi. Thanks for taking my question. My first question is on behalf of a colleague, and it's directed, I think, primarily to Minister Dix, but if Dr. Henry wanted to weigh in, would be great too. It relates to the rally with nurses on the lawn going on right now in front of the legislature, who are expressing their concern that the healthcare system is buckling under pressure, and they're upset about staffing issues, working conditions, and patient care in light of what's going on with the healthcare crisis in the province. What would you say to those nurses who are out there, Minister Dix, and they're expressing their concerns?
And I will turn this to Minister Dix just to say that I can absolutely empathize. I think across the board in our healthcare system, it has been a long, long road.
It's a long road, and it's one we're still on. The COVID-19 public health emergency was declared we started dealing with it in healthcare at the beginning of 2020. The public health emergency, that is the overdose public health emergency, is from 2016 and continues on, as all of you know, at enormous cost to people in our communities. And so these are real challenges in the healthcare system. Now, on the issue of nurses, we've seen since 2017, because we were low in Canada prior to that, as everyone knows, and dramatically low. We've seen the fastest increase of any province in registered nurses. We've seen a doubling in the number of nurse practitioners. We've seen a very large increase in the number of licensed practical nurses, of registered psychiatric nurses. You see that in the pure numbers of the nursing colleges as well. And all of those things are true, and we've added now 602 new training spaces for nurses in all those categories of nurses, which is significant. We have twice as many nurse practitioners practicing as we did in 2017, and that's a real achievement of the system. But I would say, now just give you an example about nurses, say, in the interior region. You're asking about that in Kamloops, for example, where they've gone through 2 years of COVID-19 and the overdose public health emergency and the heat dome and the wildfires, which saw people moving back across the whole region, and the floods, consequences of that for nurses working at Royal Inland Hospital, one of our, a team of health professionals and healthcare workers who have done exceptional things under circumstances no one has seen, and even within the healthcare system are extraordinary. So I think nurses have been through, and all health professionals and all healthcare workers have been through an enormous amount. And that's why we're taking the actions we're taking. Specific action, not rhetoric, specific actions. That means 6,600 more people hired in our HCAP program and our long-term care program. You'll recall the 7,000 that were promised in August of 2020. The program is not over yet. That means the leveling up of wages for healthcare workers. That means the repatriation of healthcare workers who were being paid poverty wages in the acute care system, could work 25 years in healthcare and not even have a pension. That's changing. and all the recruitment efforts for doctors and health sciences professionals, the efforts on ambulance paramedics, because we've seen an increase of 26% in ambulance calls in 4 years, and you can only meet that, especially for purple and red calls, with more people. And still, it has been immensely difficult. And today, not some other day, but today, it's extremely challenging with the number of people, largely due to COVID-19, off sick, and the challenges of the healthcare system, of people, in many cases, returning to the healthcare system. It's a difficult time, and our nurses are doing incredible work, and I am with them. Why I was with them at the vigil last night, why we're in regular work consultation with them, why on some of the proposals I mentioned, we're working with them to see that they're implemented. And why, and importantly, in health human resources, we got to take steps to make sure we retain those nurses we have, experienced nurses we have. And so I would say to them that I have heard their message now, but not just now, during the height of the Delta variant, in the early days of the pandemic, when nurses didn't just serve as the outstanding health professionals they are, but sometimes and often as the only family people had, when circumstances in both long-term care and acute care had provided less access. Those are moments in all of these public health emergencies that no one involved will forget. No one involved will be unchanged by. And what we can do now is to respond and continue to build together a better healthcare system for the future.
Do you have a follow-up question, Rob?
I do. Thanks for that. My question is, we've talked about the fact that we are still in what's been called a pandemic. I've heard people describe it as we're still in the 6th wave. I don't know if you want to weigh in on that, Dr. Henry, but I'm most curious to know about, this idea of motivating more people to get a booster shot, as well as having a higher rate of vaccination for kids, because BC does trail behind other provinces in that regard. Do you think part of the challenge now is that so many people, as we've talked about, know someone who's had COVID recently and it's been relatively mild compared to what it would have been earlier or what people expect?
Yeah, I think part of it's that. I'm not sure the wave terminology, I've never been a fan of it, but I'm not sure it's particularly helpful. We're going to see it come and go over time. And yes, we saw from the National Advisory Committee on Immunization that we do get a boost in immunity from infection, and that combination of being vaccinated and then having particularly Omicron, even a mild infection, that does give you a boost. But it's relatively short-lived. So now's the time. If you had an infection in January or February, it's time to get that booster dose now. And I know many people had put it off because they had a recent infection. And the National Advisory Committee says, 3 months, as long as 3 months to put off getting that extra dose, and that gives you the boost on the boost instead of just having them too close together. So if you have had a recent infection, now's the time to get your booster. It's going to help maintain that protection and maintain protection as we go into the next phase of whatever comes at us next. So it is really important. Same with children. I know there was a lot of young people who had infections over the last couple of months. That doesn't mean you don't need the vaccine. The two of them work together. It gives you better protection in the long run. And we are starting to see, young children from other jurisdictions in the world where even mild infections can lead again in younger people to long-lasting complications from COVID-19. So it is important to get immunized, to get protected, and now's the time to do that. Appointments are available in pharmacies around the province. I know it's easy right now. There's lots of availability, so I encourage people to go out and get that extra protection.
Our next question is from Karen Larson, CBC.
Oh, hi there. Thank you very much. Can you hear me?
Go ahead.
Okay. Thank you. My question is, have you detected any cases of childhood hepatitis in BC, and are you seeing any links with COVID?
So yes, this is one of those things that we've been watching along with our colleagues across the country. We have a case definition, and it is a reportable condition in British Columbia. I put a notice out to all physicians about that last week to remind them that this is a new phenomenon. We still don't yet understand. It is mostly causing illness. We're up to about 200 reported cases worldwide in younger children, most of them under the age of 5. There has been a stronger association, not with SARS-CoV-2 or COVID infection, but with an adenovirus infection, particularly adenovirus 41. We have had one case under investigation here in British Columbia, but they turned out not to be related to this. So currently we do not have anybody who meets the probable or confirmed case definition here in BC. But we are watching, and we're working with our pediatric colleagues. So this is still a bit of a mystery. Globally, there's a lot of looking into it. We have a very detailed, what we call case report form. If you're interested, it's on the BC CDC website to help us get a better understanding of each individual case and what might be the link. There is some speculation that it could be related to co-infections, either with SARS-CoV-2 or with some other infection, or something that we just don't know yet. So that is a really intriguing investigation, and we're monitoring for it here, but no, we have not seen any cases here in BC yet.
Karen, do you have a follow-up?
I was hoping to get an answer in French, if at all possible. If it's not, I'll ask another question that maybe I could get an answer in French for, if we can make this work.
Sure. Ask your second question, and maybe you can answer both.
Sure.
Okay, great. So in French, I'm sorry, I'm just scrolling through our list here. You, Dr. Henry, you seem to indicate earlier that changes to visitation rules in long-term care might not be immediate. Can you give people who really want to get in to see their loved ones a bit of a timeline on when they can expect all facilities to come into compliance with the updated rules?
My understanding is that those are in effect now. I don't know that any facilities are not in compliance, so there are no limitations. There still is a requirement for testing and for visitors to be fully vaccinated. We know that there still is transmission happening in long-term care homes, and as we know, it can be devastating when it gets into care homes. Thankfully, with the high levels of vaccination and the variants that we're seeing right now, even in care homes, we're mostly seeing milder infections. But those are still important protections that we have in place still.
Juste pour, premièrement, pour la question des foyers à l'habitation au long terme, je pense que les règles sont toujours en place. Et donc, je pense que la seule exception à cela, c'est qu'il vous faut être vacciné, absolument, pour visiter quelqu'un. Et deuxièmement, il faut faire un test rapide. Et je pense un peu partout, et j'ai l'expérience personnellement que ces deux choses vont être en place pour des mois à venir. Donc, ça ne va pas changer, mais en général, le changement des règles sur la visitation a déjà été lu il y a quelques temps. Merci beaucoup. Thanks very much, and we'll see you soon. We're going.
Thanks, everyone. That's all the time we have.